Yasmeen Peerjade. I have completed master's course at the Others of Mumbai, and now I am presenting my case. Case presentation: 65 years old male patient visited on 17th October 2023. Came with the chief complaint of moist oozing eruptions of both legs without itching since 6 months. Non-healing wounds on both legs since 14 years, and these are on and off complaints. Edema of both the legs diagnosed to be cellulitis of both legs. What is the effect of these complaints? Patient said, due to this, I am not able to walk. This is the patient's condition when he came to me on 17 October 2023. Both his legs, you can see the condition of both the legs. The wounds are dressed and the oozing you can see. I asked him how it is started. 14 years back, swelling of legs followed by chills with fever, received allopathy treatment. Again, second day, chills appeared back and swelling of left leg started with pains, so he has taken injection. After that, blisters came which started oozing. When he then went to the surgeon, the surgeon cut open the leg up to the thigh and calf and dressing the wound of the whole left leg. Foul swelling discharge started after 4 days, so referred to the Mission Hospital Mirrors. Much pus drained from the wound. The wound was not healing. After 2 to 3 weeks, skin grafting was done at the Mission Hospital Mirrors. Then, after 1 month of the skin grafting, wound started healing and took 3.5 months to heal. He was hospitalized for the above period. Post-surgically, the increase in the weight and size of the left leg started. After healing for first time, same episodes of chills with fever with oozing blisters turning into non-healing wounds kept on repeating. After 7 years of left leg, right leg was also affected. Then I went for the childhood history. Asked about his childhood, he told, patient said, mother told me that when I was 1.5 years old, my soles were itching a lot with cracks on my ankles and cracks were oozing. And those cracks oozed at the night, aggravated at night. He used to cry a lot during night, so she used to put ointment. The name of the ointment is germ cutter. And while narrating these symptoms, he was weeping. So I came to the patient is saying that he is weeping, so it is a emotional level and the potency is 200 C for the emotional level. I decided to give 200 potency, whichever medicine is coming. Then cracks were healing after ointment application and used to reappear again throughout the childhood. I had those oozing cracks, and due to that, children were not playing with me and teachers were not allowing me into the school. And again the patient is weeping. I used to say my mother, why me? I don't want my legs, burn them, because I couldn't sleep due to itching at night. He again narrates, father's clothes used to soil due to the oozing during sleeping beside him. Nobody was literate at my home, hence I wanted to go to school, but I was forced out of school due to oozing cracks over my ankles. After dropping out from the school in 1972 famine, I started my business, got married but disappointed very soon due to arguing nature of spouse and felt deceived. I used to beat her. She used to be the center of quarrels at the home. I was not satisfied with her. Then I asked about the sleep. It's okay. During asking physical journals, patient went to the delusional level. Delusions. Out of the time telling about the past when he was in hospital. I couldn't sleep due to the plastic mattress in the hospital. And I used to think during night that I was wandering in a deserted land with a filthy slum area. I was secluded and casted away. I was walking for a long. There was a mountain in front with vulgar settlements, market which was dirty, and ahead of that, field and all field. I have to keep on walking to come out of that field. There was a older railway station shed where filthy and mutilated people were begging. Their wounds are oozing, foul smell is coming. I just want to come out of that place. So I must keep on walking and walking. It's all disgusting. It's a delusion. So I asked about his fears. He narrated, my father was abusive. He used to beat my mother. I was helplessly watching that with tears. And again he is weeping. Everybody was afraid of my father. I don't participate in fights, violence or quarrels. And the next fear is haunted, dirty, old foreign area behind my home. No one used to go there. To overcome the demonic powers, we brought amulets and used to believe that ghosts, demons, jinns were there in the backyard. Once I went to Nanded, where I and my friend saw the exorcism. My friend got affected by demonic spirit. He used to be numb and suddenly be violent after seeing the exorcism. The third one, I saw my uncle died due to the accidental birth. I brought his dead body, which was in cold storage. After that, I was much afraid of and developed the fear of death and what will happen in the grave. These are the fears he narrated. Then I go for the physical jungles. Desires, all green leafy vegetables and fruits. Aversion, chickpeas. Sleeping position, sleeps on back. Thirsty, large quantity of water at small intervals. Appetite normal, sweat, forehead and scalp. Modalities he narrated, open air emulsion, home aggravates, cold air aggravates, winter aggravates, evening aggravates. Other complaints, acidity, retrosternal burning, omitting green in color, caused due to eating outside. The second one is coryza. Once in 2 to 3 months, starts with running of nose, then nasal blockage develops, then chest congestion and cough starts. Cause change of weather and drinking cold water. Teeth, caries of upper and lower molars. That's all sums up the case history. Now I analyze the case. Analysis you can see. Moist oozy eruptions without itching. Non-healing wounds since 14 years, on and off. Episodes of chills with fever with skin blisters. Left leg affected first. After 7 years, right leg also affected. Swelling and edema of both legs. Past history of cracks over joints which were itching and oozing, suppressed with ointment. Foul smelling discharge. Delusion of isolation, outcasted, secluded, disgust, want to come out of that place. Affected by domestic violence, fear of violence, quarrels, fights, fear of ghosts, demons and jinns, fear of death and things happening after death. Desires green vegetables, fruits, sleeps on back, thirsty, large quantity of water after small intervals, sweat, forehead and scalp. Modalities, open air emulsion, home aggravation, cold aggravation, winter aggravation, evening aggravation. Now case solving with the help of sensation method. The first criteria is the superclass. According to the 5-finger method, first one is the superclass. What is superclass? It's a core dynamic response of the patient. At delusional level, patient said that he was walking to come out that dirty place. So the core dynamic response is to come out. Dynamic of 5th superclass is restless and must get out. So we need a remedy from 5th superclass. This is the chart, superclass. Now the second criteria is the kingdom. What is the kingdom? It's the type of response of a patient. Here we don't see any structural issue of mineral and survival issue of animal. Here our patient is Patient's issue is sensitivity to every situation in his life. He got affected by domestic violence and developed a fear of violence, quarrels, and fights. He got affected by his uncle's death and developed the fear of death. He has fear of demons and ghosts, and to face that fear, he went to see the exorcism. He got affected by nature of his spouse and became irritable. He used to get affected by weather and used to become sick. Here we can see the sensitivity and reactivity of the patient, so he belongs to the plant kingdom. Now, third criteria is the miasm. It is the speed of response. At delusional level, patient feels disgusted, isolated, secluded, outcasted, dirty, mutilated, intense hopelessness, despair. All these feelings come under the leprous miasm. Now, the fourth criteria is characteristic symptoms. These are the symptoms which we can find in the repertorial totality. You can say the rubrics. Skin affections in general, skin eruptions, blisters, skin eruptions, blisters, scratching after, skin cracks, skin destruction, skin bullae, generalities, evening, generalities, change of temperature, aggravation, generalities, offensiveness, generalities, heaviness, generality, heaviness externally and internally, generalities, cold aggravation, generalities, open air amelioration, mind walking must, mind anxiety air open in amelioration, mind house aggravation, mind delusion imagination trapped he is, mind delusion imagination injury injured of being, everybody has injured him, mind room in aggravation, mind fear air open amelioration. Now I used Synergy software where I have taken these rubrics, and you can see I got the remedy Rustox. These are the symptoms I have taken in the repertory, reliable repertory I have used. These are the symptoms. You can see the rubrics. After repertorization, I got the remedy Rustox, which belongs to superclass 5, plant kingdom, but typhoid miasm. I want remedy from leprous miasm, and the remedy is Homocladia dentata, potency 200C. As I have decided when the patient started weeping during narrating the symptoms, he is at emotional level, and LM06. 200C was given once a week and LM06 was given HS for 3 months. Now we can see the fifth criteria is fulfilling. The keynote from the Fatak's Materia Medica, Homocladia dentata, where I underlined the symptom, causing malignant inflammation of the skin with enormous swelling or edema of left leg and foot. Deep ulcers with hard edges, leprosy, skin red all over, recurrent eczema. Now the follow-up, sleep quality of sleep improved, sound sleep after taking medicine, quantity of urine increase during night, frequency also increased, delusions, thinking pattern has changed, no more delusional thoughts now. Free of delusions now. Wound is not oozing, and healing of wound we can see during these 5 months. Once had the episode of fever with chills, but blisters didn't come, and fever subsided in 2 days, feeling much better and able to walk without support. You can see the follow-up pictures of the 6th December. Patient had came to me on 17th October. After 1.5 months or near about 2 months, we can see the oozing stopped and the wound, which is very much deep, you can see. This is the picture of 6th December where oozing is totally stopped. Now this is the follow-up picture of 15th January. The wound started healing, you can see. This is 1 month after, on 14th February, where the wound started getting healing. The wound has started, and this is the picture on 20th of March. You can see the remarkable change in the deep wound, which is granulation is there and oozing has stopped. Both the legs, you can see the edema is also reduced, oozing has stopped, and the wound started healing. And this is the comparison of the wound of 6th December, 15th January, 14th February, and 20th March. This is the follow-up of the patient. Now patient is very much better with the 𝐂𝐚𝐜𝐭 dentate. Thank you.